Welcome to the See Jason podcast. I'm Hillarey Stone, a pediatric nephrology fellow at Cincinnati Children's Hospital.
And I am Charles Varnell, a pediatric nephrologist from Cincinnati Children's Hospital and the University of Cincinnati.
We're happy to have the opportunity to summarize our manuscript published in See Jason titled Bleeding Complications After Pediatric Kidney Biopsy, a Systematic Review and Meta-Analysis. Kidney biopsy is an essential tool for diagnosing and treatment of patients with kidney disease. But despite this, it's an invasive procedure that can have unwanted complications. Few prior studies have looked at complications of kidney biopsy in children and generally include small numbers of patients and procedures. So we performed a systematic review of the literature for studies that describe bleeding complications after kidney biopsies in the era of real-time ultrasound guidance. We were able to identify 23 studies detailing complications of pediatric kidney biopsies that included 5,504 biopsies in 4,188 patients.
We found the proportion of biopsies with paranephric hematoma were between 11% and 18% using two different models. The need for a blood transfusion post-biopsy was 0.9%, and the need for an additional procedure was 0.7%. We performed meta-regression to see if the use of real-time ultrasound guidance affected paranephric hematoma, need for blood products transfusion, or need for an additional procedure, and it did not. We also performed meta-regression to see if native versus transplant kidney biopsies affected the need for blood products transfusion or an additional procedure, and it also did not. This study gives the most up-to-date outcomes regarding risk of hematoma as well as clinically significant outcomes after ultrasound-assisted percutaneous kidney biopsy for children. We hope that these data can be used to inform the risk and benefit discussion for patients and their families prior to undergoing this procedure.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.